Good afternoon, KIPI listeners. This is Missouri Breaks, doing our weekly show where we focus on a variety of public health topics. This week, our show is focusing on the COVID-19 Wayakta He study with Johns Hopkins University. We also have other partners like the University of New Mexico, and we've had the opportunity to have one of our research partners join us on the Cheyenne River Reservation this last week. So that is where our guest, Anna Tillery, is joining us from, and she's been working on the project since pretty much the beginning, and it's been a great experience. So we're going to share a little bit about the study and what we're learning about from the research that we're doing. So to start, Anna, do you want to introduce yourself or share a little bit about yourself?
Yeah, my name's Anna Tillery. I'm down at Johns Hopkins University in Baltimore. I've come up for the week to do some follow-up tests and air monitoring with Missouri Breaks. This is, I think, my third time visiting over the past couple of years. It's been like 4 years or so since we've been working together, and every time I have so much fun visiting and exploring South Dakota, because I'm from the coast on the south, so I don't get to see stuff like this very much. But here right now, just doing some air monitoring. Part of the study was looking at indoor air exposures and pollution and how that might affect COVID-19 health response throughout the reservation. So what we've been doing for people that might have had some high levels when we initially measured is coming back and doing some additional measuring to see if the levels are still high and where any kinds of exposures might be coming from. But yeah, excited to be here.
Yeah, so glad you're able to join us. It's been a great time having you here on the Cheyenne River Reservation. So maybe to start, we can do just kind of a high-level overview of the project. We have like 560 some participants out there from Cheyenne River. So if anybody out there remembers coming in and spitting in a little cup at the Missouri Breaks office, that's the study we're talking about. We also had our participants hang air monitors in their homes, but if you can kind of start with just a breakdown of the project and the goals, that would be a good place to kick off the conversation.
Yeah, definitely. The project was initially started as a response to the COVID pandemic to measure exactly what the COVID pandemic kind of effect it was having on the reservation, on the people in the community, and how our indoor air environments might be playing a role into our health response, and if it might be making COVID worse or just what's going on with that. We wanted to look at some indoor air pollution that is pretty common in the area, specifically nitrogen dioxide or NO2 that is a byproduct of propane use, and then also environmental tobacco smoke. So from anything like secondhand smoke to even thirdhand smoke, just how being exposed to that might affect your COVID-19 response. We did, I think, recruit about 560 people, almost 290 households throughout the community. It took us, I think, 2021, the entirety of 2021 and some of 2022 also. Just getting people to come in. Everybody did give saliva samples, like you said. I wasn't here to do that collection. I got the saliva back in my lab and got to then play with it myself, which was really fun. And then all the households also got some indoor air monitors that they had to hang up for about a week so we could get the measurements from those. In addition to that, everybody answered a questionnaire that asked about health, anything that was going on with health, especially about COVID, any previous conditions that they might have, specifically also like tobacco use. We were really interested in commercial tobacco use and particularly vaping, since that's a new exposure and nobody really knows what vaping could do and how bad it might be, especially now with COVID everywhere. And a bunch of other things like household conditions. And my role has been to do a lot of the actual lab work using the saliva in the lab and getting the COVID test results myself and taking our air monitors apart, and then also working with the actual data from the questionnaires, and then relaying everything back to you guys.
Yeah, that's awesome. And what's cool about this opportunity to like visit with you on the air is it's giving real life data back to the community from Missouri Breaks. You know, we do the data collection locally here with residents of Cheyenne River, and now we can give it right back. And I've seen things that say on average it takes like 20 years of time from the time you like have a research idea all the way until it's actually like making an impact in the community. But I feel like because we're a small local company and like have really good partners out there supporting us, it's pretty awesome to see it come back quicker, I guess, to the community and be able to use that messaging locally to help people like know what's going on and like make behavior changes potentially to make themselves healthier. So
yeah, and as a research scientist that spends their time in the lab, it definitely feels it can feel a little disjointed if we're just doing research on projects that are across the world and things. But now that y'all have gotten me down here and dragging me out every year or so, it makes it a lot more fun for me also, and a lot more engaging, since I do get to meet everybody and see the community. So, and then I get to tell my bosses that you guys got to hurry up on everything. Because they know me people, and they'll hold me responsible.
Right. There's real people on the other end of these projects, like eager to hear the results. And for what it's worth, we've drug Anna all over the res. She's been to every corner, and it's been, great to have research partners that come back and give back like that live feedback that we've been doing this week. So I think if we can maybe get into a bit of like the results and kind of next steps where we go from here, if you can kind of sum up in easy to understand terms. You know, research can be confusing, but yeah, I think we'll do our best to break it down and let you know what we learned from this. Again, if you're just joining, this is the CRST COVID-19 Wayakta He study, which translates to Are you on guard against COVID-19? And what we did is tried to learn about the indoor home environment and how that could affect COVID. And the two indoor home environment conditions, the main ones that we were looking at was secondhand smoke or vape exposure and nitric dioxide from propane. So from that research, Anna, what did we learn?
Yeah, so a quick overview. Again, I know I said it earlier, but just to say what we're working with, we recruited households, 2 adults within each household, about 7 to 9 years apart. Each household had a nicotine air monitor that measured secondhand smoke and vaping exposure. And then a subset, about 100 households, got a nitrogen dioxide monitor to measure. Those were held up for about a week or so to get a week-long average. And then each adult gave a saliva sample and filled out the questionnaire that had information about their health, COVID, and then also tobacco use. So from that, we actually are about to have our first paper published from this study. And this paper was going over all of the commercial tobacco information that we got, because we did ask a lot of questions. For those of you that did participate in the study, thank you so much for filling out. It was a really long questionnaire, but each data point is so important because we do get to use it for so many different things, which is the cool part of having such a big study. The original purpose wasn't to look at all of this tobacco use stuff, but we were able to then look at all the tobacco use, commercial nicotine products, and relate it to the health effects information that we got to see if there were any trends with tobacco use in our community or in your community, and anything like any kinds of chronic health conditions or other things like that. From what we found, about 53% of our participants did use commercial nicotine, which is pretty high, but we did prioritize when we were recruiting, getting people that did use commercial nicotine, because we wanted to include them, since people that use it are definitely vulnerable from a variety of health outcomes, especially COVID.
Right. And for what it's worth, like we know our smoking rates aren't that high, but they're still very high. Like, we have other studies that have found that we're just under about 50% of our adults who use commercial tobacco, particularly smoking. And then, of course, there's like chewing and vaping and all that too. So we do have very high rates of tobacco use. But yeah, this study, we tried to recruit even more tobacco users. So
yeah, specifically vapors too. We're really interested in that since they're so new. And like I said, we don't know much about what health effects that they could contribute to and if they could make COVID or anything worse also. So from there, we had all this questionnaire data. We asked about self-reported COVID-19 and found that about 70% of the people reported having COVID and about 85% of people reported having at least one COVID vaccine, which is incredible. That's so, those vaccination rates are really, really high.
Yes, very proud of like the tribal response to get the vaccines out in every corner of the reservation. And there was some hard work by our public health nurses and IHS and CHRs and so many others out there. And like our tribal council representatives, there was a monetary incentive to get vaccinated. So all of that work definitely worked to have very high vaccination rates for COVID on the Cheyenne River Reservation.
It's so cool to see public health incentives like work out. It seems like everything that you guys did worked really well with all the vaccine rates. So from there, we divided everybody first into the different kind of tobacco use or commercial tobacco use that they may use. People that exclusively vape, exclusively use cigarettes, and then use both vapes and cigarettes, and then people that don't use anything. We did some statistical tests to look at demographic variables and different just characteristics of the people, and found that people that did use cigarettes were more likely to be in a lower income bracket versus those that use vapes. Looking into it, it does make sense. Across the U.S., this is true.
Right.
Since vapes can be kind of cost prohibitive, they're really expensive, and cigarettes are a little bit less expensive compared to them. And then people that use dual both, we found that they have no preference for the kind of vape that they use. So it might be more of a convenience thing about if you're using both cigarettes and vapes and your friend has a vape, you'll pick that one up.
Use whatever's convenient.
Yeah, whatever is easy access. And that's true across the U.S. too. So a lot of this stuff lines up with what I've seen in previous studies that I've been a part of. But then when we started looking at the actual health effects, found some very interesting things that I think are a little bit more, what's the word? And relevant to this community and the environment that people live in. We found that the commercial tobacco users, comparing them to non-users, had actual lower odds of COVID-19 infection, which was really surprising and not what we anticipated. And I don't think you anticipated it either. And then also lower odds of hypertension and high cholesterol. But with everything I know about tobacco, it does actually lead to increased chances of hypertension and high cholesterol. And as far as all the other studies that have been done across the U.S. and across the world, a lot of smoking is related to increased risk of COVID-19 infection. So Ray and I spent a while chatting about what that could, those lower odds could be.
Yeah. And it's interesting how in research, sometimes you do find things that you're not expecting. And then you're challenged to think through, like, why could this be, or what might this mean? And kind of what we thought through is potentially that people who are smokers or vapors maybe are going to be less likely to go in to get healthcare if they have a common cold, like that could have been COVID, or if they have symptoms of high blood pressure or high cholesterol, or maybe they don't have symptoms and they're just not getting routine health care.
Yeah.
And a lot of that comes from, unfortunately, like stigmas of, okay, so I'm a tobacco user. I don't want to get nagged at. Like, I'm just not going to go in because I don't want to get nagged at to have be told that I need to quit. So yeah, I mean, there's different ideas on where that, why that could be, but there's also like things that we found that are really relevant to the community, like the long COVID. And can you talk a bit about that as well?
Yeah. I think the big result from this study was finding that people who did use commercial tobacco had about 2 times the chance of having long COVID compared to those that didn't use commercial tobacco. And I know long COVID, Rae has been talking about long COVID for a while, been getting calls from people who participated in the study and people around the community that are concerned about it. It can be really dangerous and really affect people's quality of life for weeks, months, maybe even years now. I think people struggle with it for a while. So yeah, we found that the people that use commercial tobacco had about 2 times as likely to have long COVID compared to those that didn't. Mm-hmm. So this is a really interesting finding and something that I think Missouri Breaks can really sink their teeth into when they get into the actual public health messaging and response, COVID response, and for future public health preparedness and things like that.
Right. And COVID was really scary for a lot of people. I mean, both healthy people and people that had, chronic health conditions, because, for me, I'm generally healthy. Like I'm pretty young and don't have any chronic health conditions for the most part. But my big fear was like exposing it to somebody that I care about who does have chronic health conditions and what it might do to them. And so for me personally, just learning that, commercial tobacco use, particularly smoking and vaping, can cause long COVID, which means, I guess the technical definition that we used from CDC is anybody that had COVID whose symptoms lasted for more than 4 months. And that's a long time. 4 weeks. Thank you. So yeah, that's a long time to be suffering and ill. Like anytime you've been sick, think about that cold that just doesn't go away. And then in those moments thinking like, if there's something I could do to like feel better, gosh, I would do it. But now knowing that actually smoking and vaping, is a huge factor and like doubles your risk for having long COVID could be a motivator for people from our community to say like, all right, I don't want to go through that. Maybe I've been there before and I'm more motivated to cut back or to try to make a quit attempt. And we know that, tobacco is incredibly addictive. And when I say tobacco, I'm in this context, I'm referring to commercial tobacco, not our traditional chinchasha or the traditional tobacco of the Lakota people. But yeah, we know it's super addictive and that for the most part, people want to quit and they have good intent to. But maybe if this is what it takes to get that motivation to start cutting back and lower your chances of having long COVID, it's for sure worth it. So yeah, it's kind of neat to see finally at this point in the study to get these, real life outcomes and how about like where we go from here? Like obviously there's so much data that the COVID-19 Wayakta He study, Are You on Guard Against COVID, has produced from the participants on the Cheyenne River Reservation. What else are you interested in looking at in the data?
Yeah, so like I said, we did all of that indoor air testing, and on nitrogen dioxide and secondhand smoke. So that is just I don't know what the word I'm thinking of, but there's so much data in there and we need to start digging into that also. Mm-hmm. Also, we have all the saliva where we did COVID tests and looked at the actual immune response in the person's saliva to see how their immune response or their immune system has responded to COVID and if they have an actual like immune confirmed COVID case. Mm-hmm. So the original COVID test would only catch the active infection, but then the secondary immune response one would indicate if they had a previous infection or no natural infection at all. And then also look at their vaccine response. If they had a vaccine, it would be detected in that immune response also. So there's a lot in there. And we're just starting to get into that part of everything now. So, which also ties into why I'm here with doing the additional air testing. But I think now what we really want to focus on is the nitty gritty of the immune response and see if any of these air pollutants, the NO2, the nitrogen dioxide, or the secondhand smoke have an effect on the immune system, which then goes even a step further into what the previous study did, which is looking at the actual health outcomes. This is now looking at what's going on within your body and could affect, long-term health outcomes. So maybe not even like the next couple of months, but like a couple of years down the line, you might be more sensitive to getting other viral infections, or those viral infections might be worse, or any number of things, since environmental tobacco smoke is even carcinogenic for people that breathe it in, even if you don't smoke. So there's so much more to look in now that we can look into and start to get a feel for how our indoor environment is affecting the health for the rest of our lives almost. I think it's a very undervalued part of public health.
Definitely.
But more of us are becoming aware of it after COVID. I know Missouri Breaks has air filters all throughout the offices, which is awesome.
We do. We're trying to keep the air clean, at least in our office spaces. But, just to like pause for a bit of health education, like you guys, anyone who's listening that's heard Missouri Breaks on our public health variety show before, there's always little moments of like opportunity to educate. But so what we know going into this study that's very well established in the research is that secondhand smoke is really bad for you. Secondhand smoke is also really bad, secondhand vape, if somebody's vaping around you, is also bad for you. And we know that it, like you said, causes both short-term effects of like if you're smoking around a child, they might have higher rates of ear infection or develop asthma someday. Then, of course, like long-term, there's cancers and respiratory and heart diseases. So we know that secondhand smoke is really harmful. We also know that the NO2, which is the basically what comes off of use of propane in a home, can cause respiratory problems. So that's really why we kind of zeroed in on those two indoor factors for this study, to try to understand, because COVID is still pretty new, like in the big picture, it's only been around for, about 4 years now, and we're still learning a lot about it. So if we can understand, more about two factors like secondhand smoke and NO2 in the home, and how they maybe can contribute to COVID-19, that can help us as a community, and as from Missouri Breaks perspective, deliver those health education messages out to people to encourage them maybe to smoke outside instead of inside, or vape outside instead of inside, and especially protect the vulnerable populations, which are,
for sure,
like the Wankaija, the children, and our sacred elders, and definitely anybody that has like respiratory conditions are going to be more susceptible to these irritants in their lungs, like secondhand smoke, vape, or the NO2. So yeah, just a tiny bit of health education to throw it out there. Like those are, we know that those things are harmful in indoor air, but we're learning through this study how they contribute to COVID. So yeah.
And I mean, the thing about NO2, nitrogen dioxide exposures, is that everybody's using propane. I have a gas stove at home, and my house uses propane also. And my degree is actually in exposure sciences. So like what we breathe in and what we're thinking and what we're being exposed to on a daily basis. So, I mean, at home, if I'm cooking, I turn the vent on above my stove, and open the window if it's nice out. Just anything to increase airflow in your home is going to be the cheapest and easiest way to keep your air a little bit healthier and to reduce those levels in a faster way. Things like ceiling fans, or even just like standalone fans in your kitchen if you're cooking, it's just a really easy way to get rid of those exposures as fast as possible. I've been telling everybody that we've been seeing over the past week, that I think this is the best way, and it's what I do personally, and I tell my friends that too. I'm really fun at parties. So
talking about all your exposure science.
But there are things that we can do, just little tweaks every day that aren't even like big things. If you have a vent on your fan, just press the button when you're cooking. And they definitely would make a difference.
And yeah, just opening that window too to get the air circulating. And one neat thing about this study, and actually quite a few of our studies at Missouri Breaks, anytime there's information that we learn about our participants that could be potentially helpful for them, we always try to give those results back to participants. So if you're one of the 560 people that has participated in this study out on Cheyenne River, you should have gotten a piece of mail that basically has the details of your results and explains them. If you have questions on that, if you participated and you're like, I don't remember getting that letter, I don't remember what it said, but now I'm interested, like give us a call at Missouri Breaks and we can definitely get you a copy of the results again. But yeah, that's what this is all about is, with research, it's important to, or the main goal is to make changes and try to understand like the big picture of the community and what we can do to help, change these health factors that our community is experiencing. But also, like, if there's individual benefit, like, we want to get those results to participants as well. So that's been one nice thing about this study in particular. And I know Anna mentioned earlier that we're very close to having our first publication from this study. And that's a big deal from the research perspective, but not as big of a deal for the community. Like, I don't know that the community really cares if this is published in some academic journal somewhere.
No, very true.
but where I go with this is that, like, it's that big publication in an academic journal that then can lead to research translation, which is exactly what we're doing here, is talking about, from a community's perspective, how to break that down into understandable ways and use that information then in our messaging and with organizations that can potentially make an impact. We've had conversations with CHRs about, like, is this something that, we could continue monitoring and helping people understand their NO2 exposure and help them identify ways to reduce that. So yeah, there's so many implications to even just one study. Missouri Breaks has lots of different studies going at any given point, but this is my favorite part of research, is not the data collection, but actually getting to the point where we can start making positive changes in our community and educating on what we're learning. So I'm going to give you one chance for like closing thoughts, but again, for anybody that maybe joined late in the show, this is the Missouri Breaks weekly show on public health topics. And today we had Anna Tillery from the Johns Hopkins University join us, who is a partner of Missouri Breaks COVID-19 Wayakta He study, which translates to Are You on Guard Against COVID-19? So Anna, for anybody that joined late, what's your final closing comments?
I guess just a quick overview of the project where we talked about commercial tobacco use and how it has direct implications for the health of the community around here. We saw that the people that use commercial tobacco had the 2 times as likely chance of having long COVID. And it is just great to see how we can use this research and then directly translate it into community action. And now you'll probably hear from us some more about this, where we're going to start digging into some indoor air exposures and how what we breathe in inside in our homes can affect our health in the short and long term as well.
Yeah, absolutely. So long story short, if you're a smoker or a vapor and you don't want to deal with long COVID, the best way to prevent that is to quit smoking or vaping. Or if you're somebody that's exposed to that, encourage the people that smoke or vape around you to take it outside.
Or if you haven't started smoking or vaping, maybe reconsider it.
Yes, absolutely.
And don't start.
Yes, so true. Okay. Well, with that, I think we'll wrap up. But thank you, Anna, for joining us all the way from Baltimore. And it's been great to have you come back and share the results of one of our locally conducted studies.
Thank you so much for having me.
Have a good day, everyone.